Hi, everyone. My name is John Faulkner, and I'm your host of the Smarter Systems Better Care podcast. And I'm here today with Dr. William Stiles. He's a respected urologist who is passionate about advancing both men's and women's health through expert patient-centered care. Thank you for joining us today.
Thank you. Thank you for having me. Excited to talk.
Yeah, me as well. And just to give our listeners context, tell us a bit about your background.
Yeah. So, I spent about 20 years of my life as a traditional urological surgeon. So day to day, get up early, go to the office, see patients, do surgeries, and did that for a large part of my life and, enjoyed it, got a lot out of it. But, my own health in 2020 hit hard. And what I found is that, things that I could do in my 20s and 30s and early 40s, I wasn't able to do in my late 40s. And my body literally shut down from a combination of, chronic stress, poor sleep, poor diet, not taking care of myself, taking care of everyone else, but not taking care of me. And my body just pushed back. And so I took some time off and, really tried to learn about getting better and in doing something that really I wasn't trained in the traditional system to find health and optimize my own health. I was a little bit in the dark, if you will.
Yeah, trying to find your way, kind of going through, sounds like that COVID time period where your body just kind of gave out on you as you're kind of figuring out where to go next in your life, right?
Exactly. And so, as I healed and as I used modalities that I wasn't trained in or didn't learn or wasn't aware that even were out there, that was the light bulb that went off where I said, wow, this is the future of healthcare. This is the future of what every patient is looking for, which is to feel great, to perform well, to thrive and not be sick all the time. And in our world, there's so much sickness, there's so much chronic illness. And me personally, I believe this technology piece that I'm sure we'll speak about a little, I really believe that this is the linchpin that helps so many people get healthy again.
Absolutely. And is there anything specific that you're thinking of as you came about to getting that light bulb moment medically that spoke to you and you're like, wow, this is what me to take the next step to actually act on these thoughts and like, wow, I need to make a change.
Yeah. So, I mean, there were a lot, but probably the first and the most important piece was functional blood chemistry. So taking not just the standard blood test, but taking, standard blood test takes about 20 biomarkers, but looking at 100 plus biomarkers and not using this wide range that we're so used to that compares us against everyone else in the world, but really narrowing down that range and looking at patterns and looking at the data in a different way. And when you do that, again, you get insights that you would never get. And what it does is it shows you how the body is functioning. And when you know how the body is functioning or not functioning, now we have almost a path out of illness or a path out of chronic illness by utilizing some of these advanced technologies.
Yeah, it sounds like biomarkers. I hear that term used a lot. So that's really thing that I think is really appealing to people is not just looking at traditional methods and tests and results, but really kind of focusing on like what else is out there, right? And then looking closer to kind of what you're doing today with your patients and, what's the core focus of your business today and like how do you serve your clients today specifically?
Yeah, so we are 100% virtual, so there's no brick and mortar. Everything I do is virtual, just like what we're doing today. I work with a lot of busy professionals, but I also work with women that have chronic interstitial cystitis, which is a complex urinary condition. So, we work virtually and we are focused on 100% on health optimization and improving performance. And so the first part is understanding where you are. And we use, a various number of tools, like I hear Function Health. Everyone's talking about Function Health, Mark Hyman's company, which is doing a great job as far as making people aware of this advanced biomarker. But what we do is we take those same biomarkers, we add advanced gut testing, we do advanced hormone testing, we do, advanced toxin testing, and we do food sensitivities. We do a full panel from head to toe to really identify how someone's body is functioning. So whether you're a CEO of a large company and you know you can do better with your health, or if you have someone, that's struggling with interstitial cystitis, really the system is the same. We first identify and assess the situation, see what's going on with these advanced data sets. And then we build out a 6-month program. And this 6-month program is personalized to your health goals, number one, and also your individual data. Like when you compare this to what you get in the office where you may have a 5-minute appointment and boom, you're out of there. This is night and day different than what you would get at your local doctor's office, if you will.
Yeah, it sounds like you spend a lot of time with your patients as part of that as well to make sure they feel like they're getting that kind of specialized attention and care that they deserve.
Yeah, it's definitely concierge. It's definitely focused on them, and a lot of it is education, and a lot of it is we're entering a place in healthcare. And granted, healthcare is changing so much and has changed so much over the last 4 or 5 years or whatnot. But one of the things that people really need is they need that educational component. They need to understand their bodies better. And, that's probably one of the greatest things we provide is the ability to kind of understand what's going on, where the imbalances are. So again, so that we can start building for optimization.
Yeah. And the optimization phase is going to be applied everywhere in life too, not just yourself as like, work, life, all sorts of different places.
Absolutely.
Wonderful to see. Kind of focusing like your role too specifically, like where do you spend the most energy kind of driving growth in your business today? But how does your day typically look as someone in the functional medicine space?
Right. So my day to day is spent just like what we're doing here. Zoom calls, pulling up lab values. A lot of times I'll go through a blueprint with someone. I may see 3 or 4 people a day. It's not like, like when I was a urologist and working in that field as a surgeon, I was seeing 20 or 30 people. Now it's dialed down where I do really focused, very high quality care. I spend time with people. I may spend an hour and a half with people. It just kind of depends on the situation. And so the bulk of my time is really focused on the patient or the client or whoever I'm working with. That's kind of where I spend most of my focus. And then obviously just growing the brand, if you will.
Yeah. Yeah, absolutely. It sounds like a better balance too. If you're going from like 30 patients a day or more to 3 or 4, I'm sure that's a much better workload, patient load, if you will, as you're going through it.
It's different, like it's just different than being a surgeon. It's using my brain rather than using my hands. It's using my experience and now infusing this technological advance and this data piece into what I know. And I think that's where the value is. When I start working with people, it's, I know the body, I know how it works, I know the anatomy, I know the biochemistry, I know the physiology, but now we add advanced technologies and data into that experience, and it's a perfect fit for people who it's the perfect fit for, whether it's a male or female.
Yeah, sounds like it for sure. You get that kind of specialized attention that they need.
Mhm.
And then looking kind of bigger lens, like what's one shift in your industry that most leaders are not paying enough attention to right now?
Well, I think we're so used to this sick care model. So it's you go to the doctor when you're sick, and that's the only time you go to the doctor is when you're at the end or your energy's gone or your fever is up or whatever. And it's this sick care model. And really where things are changing is that because of advances in technology, we're able to be proactive. We're able to be preventative in ways that are, you couldn't have ever fathomed this before. But so we're transitioning out of this sick care model and now doing prevention and proactivity. And so for a lot of people, I think it's different. A lot of it's just a different way of thinking of your health, for one. So, I think it takes people a little bit to kind of understand that, for one. It's also, we're used to this insurance-based model. And in my model now, I don't take insurance. I don't mess with that system because it restricts my ability to get people better. So, having people understand that your health is an investment. It's probably the greatest investment you ever make. And again, getting back to the data, when we know the data, we know what's wrong, paying money to feel better and perform better it's a win-win for everyone because when you feel better, you function better, you do your job better, you're better for your family, you're better there for your friends, for your job. Everything is improved, and, that's the type of transformational improvement in someone's health. That's what we're searching for, and that's what we're consistently achieving with the people that we're working with.
Yeah, it sounds like it for sure. And like, another question that I have is, how have you adapted to this moving from this older model of, healthcare, which is unfortunately, if I'm sick, I will then see a doctor. It could be years or months. What happens if businesses ignore that shift? Because that's a shift that I'm noticing as well. I've spoken to a lot of physicians and providers, and it sounds like there's definitely a shift happening,
Mhm.
realize it or not. So, like, what happens if healthcare ignores this? Is like a bigger question. Just curious to get your thoughts.
If healthcare ignores what you mean, where we are, you mean?
Being more proactive and
Yeah,
yeah, involved. In,
we're spending we spend the most as a country, and we have some of the worst health outcomes. So, it's like if we ignore this, we just get sicker and sicker and sicker
sicker.
and sicker. And, prevention and proactivity, it's actually cost savings. You're actually saving money in the long term. You may be making an investment monetarily or, whatnot, but you are saving long-term money by being healthier.
Yeah, for everybody involved, truly. By catching issues early and being more monitoring status, I guess is probably another way of thinking about it. Is always being aware of what's going on.
Absolutely.
And I think we are discussing as well. And we know within your own operations too, as you're working with your patients in your day to day, where do things feel like clunky or kind of slower than you'd like to see?
Well, I mean, for me, it's probably the tech. I'm personally not the best tech person, if you will. So tech and automations and, really trying to take that patient journey or that client journey where we take them from step 1 all the way through that 6-month mark. We wanna utilize automation, and I think, when you look at something as personalized as healthcare and helping someone with their health, it's not always a straight line, and so it can be tough to automate, if you will, something that's that personalized, but I think we've dialed in a lot of it where a lot of that can be personalized. It's just, still learning that stuff, as technology continues to improve. I think it's only a matter of time before things are fully automated.
Yeah, absolutely. So, like, how are you handling things like working with your patients? Because I know you're seeing like 3 to 4 patients a day. It sounds like kind of your patient load per day. How do you follow things to get people engaged and keep them engaged and interested in improving their health? Curious on your methods and how you do that.
Yeah, so some of it is with wearables. So, whether it's a Garmin watch or an Oura Ring, whether it's an iPhone, we'll use these wearables as a teaching tool, helping people stay engaged. They can watch through our EMR, they can see their sleep cycles, they can see their REM, they can see their slow wave sleep, they can see their heart rate variability. So, having them buy into the data piece and the wearable piece, I think allows them to feel empowered that they are able to control a lot of these things. And so that's one piece, which is the wearable piece. But I also send emails, and I'm very personalized with, sending messages or encouraging them. I see myself really more as a coach or a guide than I do their physician, only because, a lot of people do need that encouragement. They need someone to cheer them on. They need someone to keep them accountable.
Yeah, mindset.
Yeah,
Yeah,
mindset. And, like that's one of those things when I get on an initial call with someone, that's what I'm looking for. Do they have the mindset to make it 6 months? And a lot of people don't. It is mindset of, we're working on something it is, potentially changing their entire life. And it's not easy. It's really not. I mean, we boil it down to, diet, activity, and supplements, but, it takes a lot to stay on that cycle. And so, I think the personalized emails and things like that I send to people that I work with, I think that's been incredibly helpful in keeping them on task, if you will.
yeah, I'm sure they are. Especially, it sounds like you put a lot of effort into that and making sure that it's personalized to them when you're reaching out to keep them engaged as well. And kind of thinking about like your current results that you're getting right now, like what's working really well that you never want to lose?
What's working? I mean, the system that we're doing right now is just it's working. Like when the system is working, and again, everyone gets something different. So if I worked with you, John, you would get like the John Faulkner protocol and the John Faulkner 6-month program. It's really geared towards you. But when you look at the bones of it, number one, it's getting the right assessment. It's finding out how the body's functioning like we're talking about. And then it's then putting them through a properly sequenced process. And this is key. A lot of people want to sell a supplement here and there, but really it's a system and it's a process that gets people the results. So, we usually start with the foundation and get the foundation right and get that set piece. And then we move to the next level and then the next level. It's like a stair step, and that's working really well as far as, getting us amazing results. And, our results right now are probably upwards of 95%, and not just improvement, transformational improvement in your health.
That's amazing. That is that for the patients that are following your plan and instructions per the guidelines that you give them?
Yep, exactly,
Excellent.
exactly.
And like, what's the alternative to, I always like to ask this question, like what's been harder than expected despite all the effort that you've put into it?
The tech for sure. I mean, like I say, I'm not a tech person. I'm a clinical person. I'm a data nerd. That's where my strength is. And, like when we start talking about tech and, like I could spend 2 or 3 hours on a Canva post and it's just not a very good utilization of my time. So,
Yeah,
the tech has been difficult. I've also had to learn a completely new way of health. That has been challenging, and I was an expert in my field as a surgeon. And then I dropped down and I'm at the bottom learning nutrition and learning about gut health, learning about hormones, learning about how these toxins affect our bodies and how they contribute to inflammation and low energy and this and that. So, like learning that and then learning solutions, that has been a challenge. But, having done this now for, 2.5, 3 years, I think doing it repetitively over and over, I think our system is down so that, a lot of the variables have been taken away.
yeah, absolutely. And that's something that sounds like, if you figure out your tech, you'll get that in a good place and then it'll buy you back more time to kind of go from there, which would be amazing. And like you said, you called out another, you were, like you said, performing as a urologist and then you're learning whole new space of medicine, which I'm sure you're finding there's just so much to learn.
My
It's kind of
goodness.
fire hose trial by fire as you are working with people and,
Yeah.
oh my gosh, now I got to read about this whole new thing.
It's been
So
amazing, and that's what it is, when you start utilizing, data analytics and even artificial intelligence, what we're learning is, every 2 years we learn twice as much. So what we know today is twice as much as we knew 2 years ago, and what we'll know in 2 years is twice as much as we know now. So there's this evolution of continual learning and just exponential learning, if you will. And, as a physician, we never stop learning. And it's one of the things that I enjoy. I read and I like this stuff. I think healthcare will continue to evolve really because of convergence of all of these different technologies and, newer ways of helping people.
yeah, that's amazing. Again, there's many options as possible and educating them and how they can help them to show them the value that you are providing. And when you're kind of like, say looking in your magic ball 6 to 12 months from now, where do you want to go?
Yeah, so we obviously we want to continue to grow. We want to continue to work, obviously well with people. We still want to tweak some things, if you will. It's tough being one physician and working on one to one. So I know expanding our membership option is something that we will likely do. We also want to expand group programs and do more of one to many. So that I I'm able to use my time better, if you will. Um,
Yeah, get time back and spend more time where you want it to be.
exactly, exactly,
Yeah.
exactly.
And say you just you solved all these bottlenecks, with the tech and everything. What would success look like for you as far as freeing things up past the 6 to 12 months mark? Like, what would be your happy place? I always like to ask people.
Man, my gift is analyzing data and creating a 6-month plan. That's where I focus the best. And so if you take away all that stuff, I can really hone in on what I'm great at. And it just frees me up to be more focused in what I excel at. So and that's kind of what we're doing. We do need the tech, we do need the automations, we need all that stuff to help our business grow. And so, yeah, that's where we want to be is doing that more often. And as technology continues to grow, what I'm talking about today will be obsolete. I mean, there may be other things that advance this industry in such a way that we can't even comprehend right now. And so I always leave room for that. It's this is a vastly changing area, and so much can change on a dime.
Yeah, hour by hour at this point, especially with AI,
Yeah, yeah,
or minute by minute in
yeah.
some cases.
Yeah, you're right. You're right. I mean, even through laws and legal and through the government and like healthcare is just it's improving or changing. It's changing dramatically.
Yeah, it is. Absolutely. And thank you for your time today on the podcast. Where can people find you if they want to connect and just learn more about what you do and how they could potentially, be a participant in one of your programs?
Yeah, so I'm on LinkedIn at Dr. William Stiles, and then my email is william@drwilliamstiles.com. um, Through our website, and just fill out a contact form, and I'm usually pretty good about getting back with people.
Excellent. Thank you for your time today. It's been a wonderful discussion. Thank you.
Hey, thank you, John. Appreciate it.
You too.